chain drug review, and mass market retailers video forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to have as our guests two key executives at Cencora. They are Kenzie Hohman, National Vice President of Community Pharmacy Solutions, Solution Delivery, Practice Management, and Advocacy, and Tim Weber, National Vice President of Community Pharmacy Solutions, Strategy, Innovation, and Practice Insights. Great to see both you guys.
Thanks for having us.
Maybe we could just start by you telling us a little bit about yourselves. And Kenzie, I know you're new to Cencora, so maybe you could tell us about your background.
Yeah, thanks so much, Jeffrey. I joined Cencora earlier this year in May. I'm a pharmacist. My experience and expertise, I spent quite a bit of my career in the care delivery side in both rural and urban settings. One thing I like to share is my upbringing is in the rural setting, and when I did my MBA, master's programming, there was an emphasis in rural healthcare. So that's something that's very important to me and something that I look to bring forward as I work within Cencora and with this team. Most recently, I worked at a large health system. I was the vice president of integrated care. My focus was on integrating care teams and advancing care delivery to improve quality, value, and performance. I also practiced as a pharmacist and led pharmacy teams across the care continuum.
And Tim, I know you've been with Cencora a bit, but maybe you could tell us about your career path as well.
Yeah, happy to. So also a pharmacist by training. I've been in retail pharmacy the bulk of my career. So graduated in 99. I've been in retail pharmacy pretty much the entire time since they're at both national and regional levels. I took a little bit of time and did a 5-year stint at one of our nation's leading health systems, but also doing retail and specialty for them as well. I think at Cencora, I've had the opportunity here to work on both the health system side and now the community retail side, and in both roles, really driving, looking to ways to drive efficiencies and improve just the ability for pharmacies to deliver care. I think in the new role now, I'm focused primarily on developing the solutions that allow operational change to occur at a pharmacy so they can evolve what they're doing to meet the needs of the community.
Maybe both you could tell me a little bit about Community Pharmacy Solutions for people in our audience who are not familiar with it. When was it established, and what are the objectives that you guys are pursuing?
The Community Pharmacy Solutions team is part of Cencora's community retail and long-term care segment, which is led by Tim Turnerhouse. In May of 2006, we kind of reformed the Community Pharmacy Solutions team and kind of reimagined how we're going to evolve this team to meet the evolving needs of the marketplace for the community pharmacy customers.
I guess just to add on to what Tim said is it's really clear in the market that the pace of the change is accelerating, and the Community Pharmacy Solutions team and the development of that team was developed to bring together the expertise, the capabilities, and to be more responsive, to bring greater speed and focus and agility to the market to support our customers in these particular needs. I mentioned in my introduction my background in care delivery and focus in rural healthcare, and where the positioning of CPS, the Community Pharmacy Solutions team, and that opportunity to evolve more quickly with customers, support at a larger scale, the opportunity to support customers in adapting to those market conditions and really helping independent pharmacies be competitive and resilient.
Both of you indicated the idea is to look at the challenges that pharmacies face, particularly independent pharmacies, and help develop solutions for them. What problems are Good Neighbor members and other community pharmacies most concerned about at this point? So where are you guys concentrating your efforts?
We know that pharmacies continue to experience challenges with reimbursement pressures, rising operational costs, staffing shortages, increasing demands on their time, their resources. That hasn't changed. When we spend time with customers, including last week at ThoughtSpot, we're hearing most often that they're looking for ways to reduce complexity, to create capacity, to serve more patients or to take advantage of new opportunities and to become that healthcare hub in their community. And that was part of, going back to the beginning, the reality of the driving force in the formation of community pharmacy solutions.
I think just to add on to what Kenzie said, I think the pharmacies are really the center of healthcare in a lot of the communities here, and so they're being asked to do more and more clinically and wellness related. And so I think we have to find solutions that drive some efficiencies and productivity and enable them to step into those spaces, but also then work with them to find ways to make sure they're paid for those services as well.
And Tim, what type of tools does Cencora offer to help people get at those issues that we've been discussing?
Some of these sit within our Good Neighbor Pharmacy program, and some of them sit in other segments of the business as well. But the team is really focused on driving a network of resources, either within Good Neighbor or outside, really that drive expertise. So business coaching, merchandising, and those types of services that allow pharmacies to engage in the business of pharmacy itself. And then the technology then supports the efficiency and the productivity side of the business, where there's technology to allow them to advertise. So as they step into new spaces around wellness and clinical services, they've got an advertising and a technology platform that allows them to build some level of an omni-channel experience that matches what the customers are looking for today. We have an insight data solutions team that spins up analytics and dashboards, and the intent of allowing the pharmacies to see both opportunities for improvement and for business growth. So we'll continue to help define particularly around technologies. We're really focused, but there are other solutions and services that we're really looking forward to, like specialty care. With 340B at ThoughtSpot, we launched a new 340B gateway to allow 340B to be very seamless for the community pharmacies as they step into that space. And then we'll continue to find new revenue and expense saving opportunities along the way.
You mentioned technology a couple times. What are your thoughts about AI and pharmacy practice?
Yeah, AI is evolving into the technology, into the pharmacy practice space, right? There are pharmacies now that are using AI to do data entry, and so they're not really touching data entry. Where the AI bot is doing the work of 3 or 4 data technicians. So I think that'll continue to evolve. AI's technically always been in pharmacy practice. It's at some level, right? It's been doing indication checks and dosage checks and things like that. Light version of AI for many, many years now. But as it continues to evolve, it's gonna take on a bigger and bigger role within the dispensing process, and particularly, and hopefully that drives some efficiencies that allow them to step into these clinical spaces a little more aggressively than we've been able to.
Yeah, I think you said it really well. It's here. There's been elements of it. It's not going to replace the need for a pharmacist or the pharmacy team. Patients still look for that trusted partner for their journey. And I think where we see AI stepping in is really taking away some of that administrative burden, helping. We talked about freeing up capacity. That's exactly how we see it fitting into the practice.
What more needs to be done to really unlock the full potential of community pharmacy?
Yeah, I'm going to go back to creating the capacity, not just improving efficiency, but really unlocking that full value of pharmacists as healthcare providers and ensuring that community pharmacy is an essential part of the healthcare ecosystems. There's already many communities where pharmacies are the single destination point for healthcare. That trend will likely continue, and we need to help support our customers in creating the capacity to do other things for their communities and the patients they serve.
On top of that, right, they're going to build more sustainable business models. I think we're just talking about AI, right? AI can really help them do better decision support. And so really understanding their patients and the patient's family and how they interact with the business and the community. And really, I think we're going to have to find ways to help them unlock some of those opportunities, whether it's through AI or other technology means, to really allow them to build a sustainable business model on top of helping them find reimbursement for a lot of those things.
And you too, I expect, would see expanded scope in areas like test and treat, maybe more in immunizations. I know a lot is being done already, but perhaps more, and perhaps monitoring chronic patients and that sort of thing. Yes? Yes,
and you see the remote patient monitoring, remote therapy monitoring, all that that is really starting to take hold. You're seeing more and more pharmacies being able to get in that space. And you talked about the rural grants that are out there. A lot of them are based on, where the pharmacies are able to participate. A lot of the role of the pharmacy is that remote patient monitoring and counseling opportunity that exists within those rural transformation grants that are out there. So I think you're starting to see pharmacies really embrace technology from a clinical standpoint. And stepping into areas they haven't stepped into before, even in test and treat, and some of as the scope expands, there's technologies enabling them to kind of get into that.
And I guess to get to that point, we need to have some regulations changed, perhaps some laws changed as well, and advocacy becomes critical. Kenzie, maybe you can talk about what Cencora and your team are doing to try and move the ball even a little bit beyond the PBM reform that we saw earlier this year.
Yeah, happy to. You hit the nail on the head. I mean, all that we just talked about of serving communities in a different way, advocacy is so important to that. And that's one of the things that really drew me to Cencora is their commitment to advocacy and showing pharmacy customers the impact that advocacy can have. Last week at ThoughtSpot, we recognized our Good Neighbor Pharmacy champions, and one of the awards is around advocacy. This year, Moreland and Devitt was the 2026 winner, and it's a really great example of advocacy in practice. Scott Soul and his team, they connected policy issues directly to patient impact. They educated their community and ended up generating more than 650 letters to Illinois officials in just 2 weeks. So just a great example of the advocacy that customers can have and the role that Cencora provides in that. Another great example is the annual NCPA fly-in event. We join our customers on Capitol Hill, meet directly with Congress and their staff, again, bringing to life that real impact and what our customers are facing on a day-to-day, and highlighting the value that community pharmacy can bring through those services.
And are you guys optimistic that the Main Street Pharmacy Act will get passed sometime soon?
Yes, we are. I think we remain deeply optimistic about the industry as a whole. I think we're starting to see some advocacy efforts pay off. You're starting to see government programs that have good reimbursement for pharmacies. And you're seeing now this movement for reasonable and relevant terms, at least within Medicare and Medicaid. So, even in the face of all the challenges that exist today and existed previously, the pharmacies have remained resilient. They continue to have their voices heard. And we're starting to see this trend change, at least within the regulatory environment, that's going to enable pharmacies to be to step into new areas, but then also kind of shore up their base business from a reimbursement standpoint. So they can continue to have that unwavering commitment to their communities and to their patients.
Final question for you guys. As you noted before, you just spent time at the ThoughtSpot conference where Cencora brings its customers and the Good Neighbor Pharmacy teams together. What were you hearing from attendees, and what is the attitude? Is there optimism in the pharmacy profession these days? Kenzie, you want to begin?
Yeah, ThoughtSpot was amazing and exciting experience. It was my first time. And it was really clear to me that there is an overwhelmingly positive sentiment and outlook on the industry, and pharmacy owners were really actively looking for new ways to serve their patients, diversify their business, and strengthen their role. They're not standing still. We saw a lot of interest across the owners and services that expand access to care, that improve outcomes, and create a more sustainable model. We also heard a lot of commitment to advocacy. We talked about that earlier today, and we heard that recognition of the importance of sharing their stories and demonstrating the value, and the real world experiences being really important to incorporate into conversations with policymakers and industry leaders. Another exciting thing at ThoughtSpot is we got to celebrate with our customers that Good Neighbor Pharmacy was recognized by J.D. Power as #1 in customer satisfaction amongst chain drugstore pharmacies. So that was a lot of fun and really just an amazing recognition of our customers and the work that they do every day.
Well, congratulations on that. And Tim, I assume you've been to a few ThoughtSpots over the years.
Just two, actually.
Okay, well, how did this year compare to last then?
I think last year was a very interesting year. IRA was getting ready to kick off. There was a lot of uncertainty in the market on how that was going to affect their business. And so there was this just level of uncertainty and uneasiness about what next year could look like if the MFP program came into play and it blew up or didn't roll out real well. I think this year, to Kenzie's point, there was this optimism, right? That's behind us. It's working. It hasn't made our business that much harder, and actually, in some cases, improved our profitability on those prescriptions. So there was a larger focus, I think, pharmacies of willing to step into almost any solution we had on the floor. There was general interest in exploring, figuring out how it works in their business, and really working with even our internal business coaches. They had more meetings this year than they've ever had at one of these conferences. So just the engagement level of the owners that attended significantly higher this year with a lot less uncertainty.
Well, that's good to hear. I want to thank you both for taking the time to fill us in, and we'll be in touch. Thank you.